Public health is in your seatbelt, your sidewalk cones, and your neighbor's job offer. In this roundtable episode, 3 public health professionals share the real-life stories they use to explain their work to friends and family, why loneliness is a growing public health crisis, and how workforce development is shaping the future of behavioral health. You're listening to the PHEC podcast, episode 449. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guests and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support that we provide falls in the category of strategic planning usually, but it also sometimes falls into capacity building, just depending upon the needs of the organization. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will be provided in the show notes. Today, I am joined by 3 public health professionals to dig into something we've all been asked, but we often really don't have a great answer for. When someone outside the field asks what public health actually is, what do you say? I'm joined by 3 guests, each bringing a distinct lens. Together, we explore storytelling as a public health tool, the mental health workforce shortage, senior loneliness, and why arming people with the right language echoes far beyond the conversation. Let me formally introduce each of them to you, and then I'll connect our conversation. Michelle Alexandra is a healthcare consultant and executive coach who specializes in electronic health records, or EHR, implementation, quality improvement, and improving outcomes for patient populations that are often overlooked. She is deeply committed to addressing healthcare disparities, particularly for people of color and rural communities, and consistently asks the critical questions of why inequities exist and how systems can do better. Alexandra Piotrowski is an epidemiologist, project manager, and the founder and CEO of Piat Public Health. She works with public health, healthcare, and social impact organizations to assess community health needs, center equity, and translate complex data into clear, actionable strategies. Her work includes community needs assessments and engagement, evaluation, strategic planning, and data collection and analytics. Dr. Sarah Hartzell is a public health researcher dedicated to improving mental health outcomes for people and communities. Her work explores how community and policy changes affect well-being, including a recent publication on adolescent suicide attempts during the COVID-19 pandemic. She now works with the Behavioral Health Education, Retention, and Expansion Network of Nevada to build Nevada's behavioral health workforce and help ensure all communities can access the support they need. Let's connect our conversation right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Welcome to this roundtable episode. I'm not sure what I'm calling it, but it is part of a special series that we have here on the podcast. And we're really focused on explaining what public health means in plain language. I believe truly that this is how we can have a greater impact, and it's almost an immediate impact if all of us that are involved in public health can really explain this to our friends, family, our close circle, friends, people that are already near us to really understand what public health means. Because when people are armed with truth, then that disseminates out broadly. We get more buy-in from community that goes toward advocacy and up to lawmakers and legislators. And it just prevents us from being so easily removed. And in terms of the programs are really important. If they truly understand the connection to public health, I feel like that goes a long way into helping us build a more sustainable and solid foundation. So with that in mind, this series we kicked off a few months ago, and it's picking up momentum, and I get even more excited every single time I invite guests on. So I have a fresh roundtable of guests that are on the podcast with us to share their views and perspectives, and I'm really excited about it. So we're just going to take a moment and go around and do some introductions. And I'll start with Alexandra. You go first. Please introduce yourself.
Hi, everyone. Nice to meet you. My name's Alexandra Piotrowski, or Ali for short. I am an epidemiologist, a project manager, and the founder and CEO of Piat Public Health. So I work with health and social impact organizations to help them better engage with the people they serve, understand community needs, and make sense of different types of data, and then use that data to try to improve community health and health equity. So I do a lot of things like community needs assessment and engagement, program evaluation, strategic planning, and data analytics. I really try to bring together data, community, and decision making. I'm also really passionate about mentorship and staying involved in the community. So I do a lot of mentoring of students and early career professionals, and also really passionate about aging. And I'm on the board of directors of the Toronto Council on Aging, which is where I live. So I do both work in Canada and the US, and really excited to be here.
Thank you, Alexandra. That's really a great introduction. And it sounds like you are, like a lot of us, passionate about several areas in population. So it's really nice to have you on board. Dr. Sarah Hartzell, can you please introduce yourself?
I'm Dr. Sarah Hartzell, and so I'm a public health researcher and a mental health advocate. A lot of my work has really just been trying to improve mental health outcomes for people in communities and breaking down the stigma surrounding mental health and mental illness. So a lot of my research work explores how social and policy changes affect our well-being. And in my professional work, I'm the regional project coordinator for the Behavioral Health Education Retention and Expansion Network of Nevada. Really long name, but we just call it Be Here Nevada. So right now we're working to grow the Nevada's behavioral health workforce and really just help ensure that all communities, regardless of their access or anything like that, are getting the support that they needed, and to really start to eliminating the disparities we're seeing, especially in the rural areas in our state. On top of that, I do a lot of volunteer work for our community. Right now, I'm on the board of directors for NAMI Northern Nevada, a local nonprofit providing free mental health resources and programming to our community, which is really great. We do a lot of work with peers and building up our peer recovery support specialists in our community, which has been a really big thing. And so a lot of what I do is trying to see how can we better impact those around us, which then starts to trickle through our communities, our neighborhoods, and overall our society. So thanks for having me.
Yeah, thanks for joining us. I appreciate that and look forward to your contributions in this conversation, especially given your background. And we'll go over to Michelle. Please introduce yourself.
Hi, I'm Michelle Alexander. I'm from New York City by way of Alabama, Roll Tide. And I come to this discussion as a person who's a public health advocate. I work in quality compliance. I always work to improve outcomes in healthcare for patients. And I do this mainly through quality and compliance. But I also work with workflow, AI, helping providers and their staff understand this benefits you, help with the value proposition. I've seen many providers, many nurses, people feel like, oh, they're just rocks, but this is breaking them down. They don't understand this. And public health right now is in crisis, and it's also breaking down. And I'm here to advocate not only just for public health, but also every place I've been, I've established internship programs. And ironically, I call him my daughter's fiance. He's going to see this. He went to work for the CDC under my guidance. My thing is that he specifically said, you got to tell people they need to understand the public health industry. He has masters from Columbia. I think we need to bring more young people in this field, and they need to understand it.
Thank you, Michelle. I like that. And I agree with you. So this is actually going to connect really well with our discussion overall today. So thank you all for those wonderful introductions. And again, this is going to be very relaxed, conversational. We're exploring this lane and collecting the stories and feedback as we continue on with this series. Again, the question is, I'm going to ask for each of you, how do you explain public health to friends, family, maybe even colleagues, depending on where you work, people close to you, that when they ask, what is public health? So I'm going to start with Alexandria. I like to call you Allie, but now see your name here is Alexandra. So, and I want to keep saying Alexandria, so apologize. Alexandra. I'm going to be in the names today. You guys just have a little grace for me. But Alexandria, the question I'm going to ask you first, when you are in a setting with friends, family, people close to you, and they ask, what is public health? How do you explain that?
Yeah, that's a great question. And I think it's so awesome that we're here discussing it because it seems like a really simple question to answer, and it should be, but it's often not. And I feel like I'm constantly trying to figure out ways to explain it better, especially I think since I started my own consulting business, and I'm a really big fan of collaborating between sectors. And so I'm trying to explain more and more to people outside of the sector what it is that I do. So I explain public health as the big picture behind the scenes work that creates fair opportunities for all people and communities to live healthy lives. And healthy lives is whatever that looks like for them. So it's not just one way. So it's really about looking at communities, not just one person, and asking why some groups of people are healthier than others and what we can do about it. Understanding that public health is often invisible. So when it's working well, nothing dramatic happens. We don't see the diseases that were prevented. We don't see the rules that keep our drinking water safe or the programs that make moms and babies healthy. It's a lot about prevention, and prevention doesn't really make headlines. And not everyone's, unfortunately, starting from the same place in terms of public health because of systemic discrimination and societal challenges. So it's really about focusing on the environments that people live in, the policies and the programs and the resources around them to work to give people a chance to be healthy, understanding that health is not just the food that we eat, how much we exercise, the hospitals that we have access to. It's really a lot about the communities that we live in, the resources that we have access to, and the opportunities that we have. And I think it's also important to emphasize all the different dimensions of health. So we often think of health as just physical, but also looking at mental, emotional, spiritual health, the many, many different dimensions of health, and understanding that health can look different for different people.
Thank you for that. So I think that really is a nice plain language way, how we are in the background. I also like how you touched on a point that we all are aware of. We say it all the time. Public health is very broad, which also adds to how complex and confusing it could be when trying to explain it. So that's a really great way of painting the landscape of the behind the scenes, how it overlaps as well. But I'm going to keep going, and we're going to come back to some more feedback on what you said, Alexandra. But next, I'd like to ask Dr. Sarah, how do you explain public health to your friends, colleagues, people close to you when they ask, what is public health?
Definitely. So for me, when I public health, those basic terms, it's all the programs, initiatives, strategies, and policies that are implemented not just to help the individual person, but also to impact the community and overall society. So I refer back to my work on mental health and behavioral health, how I already kind of like alluded to, there's this whole other things when you think of health and our well-being. It's not just physical health, it's all these other things combined. And so for my work, there's definitely this clear lack of a behavioral health infrastructure, not just in my state, Nevada, but in the US and worldwide. That when you look at all the research coming out, we are not going to get enough providers that we need. We're not going to get enough therapists, social workers that our society truly needs to be sufficient. And that's really just hard to hear. So then we think about, well, what can we do? And so then that's when public health steps in and saying, how can we maybe create new job types to fill in these gaps that communities need? How can we bring in more people to come back and get a certification or don't have to go to higher education to get a degree, but can work and get something a little bit to get them into the door and then get involved into behavioral health. And it's just so much important because all of us are impacted in some way with our mental health. We all have bad days, no matter who you are. And we all need to develop like things like coping skills. And there's so much work to be done to just break down the stigma and to just even talk about it. So even coming on to podcasts like this, or when I'm talking to my friends and families, for me personally, what I believe in, the more I talk to them about it, the more their gears start to turn. And then they hear these things and it's like, oh, okay, so it's not something that I shouldn't be talking about. It should be allowed and it should be in a safe space. And let's just talk about it more to create these safe environments. So that's kind of like a little bit of things that I think of when I think of public health. It's all around us. It not just helps us, but when we help ourselves, it trickles down to those around us, our family, friends, trickles even further into our neighborhoods. And then it trickles even broader into the communities and societies that we all feel these impacts from maybe these kind of like doesn't seem like impactful, but it really truly is these smaller kind of programs.
Yeah, I agree with you on that. I'm going to continue and hold on with my feedback right now, but I would like to hear from Michelle. Same question for you. How are you explaining public health to people like your friends, family that are close to you when they're asking that question?
I explain to them that it's about their world. Public health is about the community. It's not just about the providers or the doctors or the nurses. It's about everything. And the biggest thing that came up recently that I explained to someone was asking, I still don't get it. And I said, well, okay, let's look at Baltimore. Baltimore used public health to reduce crime. They used crime as a disease. That's what public health does. It identifies demographics, it identifies what are the causes or what's creating this. And then they built programs and incentives and initiatives that reduced the crime rate. A lot of them had to do with mental health. A lot of them had to do with quality and compliance. A lot of them had to do with living situations. The irony is all of these are in your intake program form. So when you go to the doctor or the hospital, they ask you, how'd you get there? Where do you live? What's going on? I explain to them, public health is about our lives. And it's everything. If you're having a baby, it could be the baby unit is the happiest place in the world, and it can be the saddest place. But that's why neonatal care is important. That's why counseling and education is important. I always remind them, it's not just important for the physicians, it's important for you, and you need to be involved.
Thank you for that. And you actually said it's a perfect segue into something that I'm going to ask each of you to think about. Some of the best situations, like you just provided some examples, Michelle, from some specific examples to help people wrap their brain around what you're explaining. So I'd love to hear from Alexandra and Sarah as well. What are some specific examples that you can share with people? Because you can explain the way both of you are explaining makes sense. And we're a bit biased because we're already in public health, but I do think that those are good explanations. But I think the stories are what people can connect with. So I'll give you some examples I've been hearing recently that are just top of mind. Basically, this is like inside of our private community that we have. And one of those examples was a story about when you see like a pothole, like if there's a hole or something in a walkway, that if you stepped into it, it could get hurt, or it's a dip and it could be dangerous. They haven't fixed it yet, but they want to protect people. So they put these cones around it. So if you're walking, you see the cones around it, to walk around and avoid it. Well, that's public health. No one's going to walk around and just think of that as, oh, that's public health. But that's the kind of story that can help people understand, oh, I see those all the time. Or another example is on the sides of the highway, those little grooves. It could be on a walkway as well. There's grooves in the pavement that if you drive over it, it makes a horrible loud sound that lets you know, okay, veer back into the center lane. But that's also a public health initiative in that preventing the accidents and the crashes from people going off on the side. And then another one that comes up a lot is seatbelts. The seatbelts that we're required to wear that's a public health initiative, you know. Do you have any other examples of public health, like those little stories, whether they're your own or just something that you've heard from somebody that you could share that maybe you've shared it with people as well, but that helps them understand and kind of wrap their brain around the concept of what we're explaining to them? I'll start with you, Alexandra.
Yeah, sounds good. And those are great stories. And I feel like the most effective stories are often like choosing examples that are a little bit outside of the box of what we maybe don't think of as public health, because we might think, oh, yeah, like a nutrition program helping people eat healthier or an exercise program or something like that. Like that seems more obviously public health, but people don't necessarily think of things like preventing crime as a public health issue when it really does affect the public's health. Something that's coming to mind for me, like I said, I'm on the board of directors of the Toronto Council on Aging. And one public health issue that I think is really increasing in importance is loneliness. And we saw that during the COVID-19 pandemic, especially with social isolation. And it has huge impacts on people's mental health as well as their physical health as well. And particularly seniors who often don't have as much social support in their lives and may not have as many friends and family around them to support them. So one of the things we try to do is just provide opportunities for seniors to get together with each other or with people of other ages and just be able to have that social interaction, have meaning in their lives, not just serving them, but giving them the opportunity to volunteer and give back to the community as well can have really good impacts on mental health. So that's something that's really meaningful to me. And I think, loneliness is a huge issue that we need to be addressing in our communities.
Yeah, it's a great example. Important work for sure. But yeah, I think it's a great example as well of that prevention and that connection to public health. What about you, Dr. Sarah? Do you have any examples, stories that come to mind?
Definitely, yeah. Whenever I think of even examples, it's just for public health, we need one of the stepping stones is to be proactive instead of just reactive all the time. Like, what can we do to mitigate some of these consequences? We know what's going to happen. We have all this research staring at us in the face, with, Ali's example of like isolation and that loneliness feeling and how that can be so detrimental to our health. And for kind of examples that I can think of, especially for Be Here Nevada, we're working to try to grow the workforce. So especially too, when you're talking about people about public health, workforce development is a huge component of it. How can we get people interested in these careers to be a stepping stone? So a lot of like what I'll do sometimes is going to high school career fairs across our state. And even in the rural areas, we're going out, we're trying to hit every area we can to just provide information to students and to just give them options of like, did you know this is actually a career? And you have so many students coming up of like saying, oh yeah, that is me. Like I am the person my friends come to tell all their woos and their stories. And I'm just sitting there listening and I actually enjoy it. That's a job. You can do that for a living. And I was like, yeah, here's just education. Here's some material. Just consider it. Let's stay in touch. Like reach out to our team. Like we're happy to talk to you more about it. But like that's even public health because by getting these students interested early on and just thinking about it, then if they get into the career, now we have a new therapist. Now we have a new social worker. Now we have, a new registered behavioral technician. We have these great people in our communities helping. And what's even better is like telling people that if you can encourage people in like rural areas and these things to pursue these different types of careers, they're the ones more likely to return to their rural communities to work in those areas. So now we're helping out these rural areas that desperately need more providers, is that we're encouraging the people who are more likely to go back and serve them because they have those ties. And so I think it's one of those beautiful things of public health. It's bigger than anything we could imagine, and people don't realize it.
Yeah, that's a really great example that really feeds into sustainability long term, which is like for the industry of public health and also the service that we all are focused on providing. Michelle, did you have any other story examples or any examples that come up for you around explaining public health?
Yes. One of the things I remind people, and I did this throughout my career, the Affordable Care Act used to give incentives to underemployed people. That was public health. It was implemented by the public health department here in New York. So whenever I went someplace, I would try to reach out to the communities, whether it was the high schools as you did or the colleges, and try to engage in internship programs and build relationships. But also, it wasn't always about the youngest people. It was about the people who were not working or who might not have been working because something happened. And so when I became director of informatics at a mental health clinic, I insisted that we start an internship program in informatics. And we got people from, of course, colleges, but we also hired people in welfare to work who had great skills. And I always remember one of the people I interviewed, it was a temporary job. And when I looked at their resume, they had the right key performance indicators, which means that they had the right skills. If you put them all together on a resume, that they could do the job of helping implement a system and putting data in. And this person said, if I make $40,000, I'll be doing great. And this person ended up making six figures. She knew what she was doing. That's public health. You're getting people back to work where they are. She was able to buy a home. She had children. She is not just her, but this is a part of public health. Most people don't know. Many of the work readiness programs are those initiatives. But like I said, that one really touched me. And I remember going, and I was kind of upset, to her housewarming party. And she said, I have to thank Michelle. And I'm like, no, you don't. You did all this. But that's public health. People need to feel better about themselves. And that means her children will be doing better. It means that she will be contributing more to the system. Her health will be better, and the community will be better.
It's a perfect example that aligns with what Alexandra said a little while ago about how public health is more than just, it's that WHO's definition of health, more than just the absence of disease. It's your physical, mental, emotional, spiritual well-being, or all of that is encompassing. So the example you just gave touches on so many other areas beyond the absence of disease, really solidifying and bringing to life the example of definition of public health. I think we have a lot of those examples in our lives that come up every day, and we may not think about them. But my challenge to everyone is to start to think about those and start to bring those stories into your explanations. And when you're explaining public health to people who don't understand, give them the definition that makes sense, that seems simple and unclear, and then share a story right along with it. Because oftentimes they'll remember the story first, and then they're able then to connect the dots back to the other pieces. And then they're going to be explaining it at some point to someone else. So if we can arm them with something really solid and the truth, then we want them to keep explaining it and sharing and talking about it. So
the one little thing, you're right, because during COVID, I happened to be at risk, so I was at home, so it saved my life. But my daughter told one of her friends, she said, oh, we knew it was going to happen. And I was listening to her talk to her friend, and she said, well, my mom, she works in public health, and she was looking at the trends and everything in the news, and she could see that something was happening. So we started buying food, and she bought a freezer. And I was like, for her, it was about sustainability and eating. And you're right. People use your examples. That's why you hear me use, I know to speak, but people don't want to hear to speak. Sometimes I get too technical. They want to hear how it relates to them. And it just shocked me when my daughter said that. I was like, okay, she gets it.
I definitely relate. Every now and then I'll hear my husband say something that actually makes sense, because his story, and when he explains to people what I do, is really like something that he's made up. He's made it so much different than what I was actually doing. But lately I've been hearing him explain it to people much more accurately. So when you've got people around you that are excited about what you do and they want to talk you up and hype you up, at least make sure they're armed with truth and it's clear, so that they're really sharing accurate examples and stories. And I do hear often how some of my friends are explaining to other people and advocating. And I think it's a proud feeling. Like when you describe Michelle's kind of like, wait a minute, what? She's saying this? But it's a proud feeling. We know that that's how things work. We hear about, a great restaurant or, something new that happened in our area, and the word gets around because everybody's talking about it. So we want to be able to Well, the pandemic has got everybody paying attention to public health. So the attention's still up. So I think this is a great time. It's always a good time to really be sharing good stories. But I'm lifting up this What is Public Health series and continuing that, because the more I talk to people about it, the more stories emerge, the more awareness. And then after this, you all are going to be thinking about this, processing it, and continuing to share. And I think that momentum that we have that's going with this series, we want to keep it going. So before we wrap up, I do want to give you an opportunity to share any last words, final thoughts, and we'll just kind of go in the same order. I'll start with you, Alexandra.
Yeah, sounds good. I think, like you said, it's a perfect moment for the series. And it is very good that there has been a heightened awareness of public health with the pandemic. I guess that was kind of a good side effect, although I think there is still limited awareness of everything that it encompasses and how broad it is. I think it taught people, like, yes, we need to address pandemics and infectious diseases, and that's a part of public health, but not necessarily everyone realizes that it also includes crime, it includes loneliness, it includes mental health, and it includes our environments, so many different things. So I think we need to keep pushing for everyone to understand all the things that it includes. And it's not just important in an emergency, it's an important thing all the time so we can be prepared for the next emergency and address all the other areas of public health that never go away.
Well said. I'll go over to you next, Dr. Sarah.
Yeah, just for people, ask questions when you're uncertain about things, when things don't seem right. Please ask questions. There's people around you who work in these fields who would love to just talk and just share their insights. And even along with that, I know book clubs are always popular, but I always highly recommend check out these great books that talk about public health issues. I mean, there's, thinking of a couple recently that I've read. The Anxiety Generation is a great one, talking about, social media use amongst kids and youth and how to engage in these conversations, the impacts of having all this emerging technology around them, what they can do. And then one that I'm reading right now is Storming Caesar's Palace, talking about how Black welfare moms in Las Vegas, they drove political change. And it's just such an inspirational book to show how these mothers took it upon themselves of solving the community's issues. And it was through advocacy, it's through public health. So there's a lot of great resources out there. And it's just sitting down, knowing, just ask those questions and be insightful and be curious. Be curious about what's happening around you.
That's great. Great advice. Thank you for that. I'm going to have to make a note of that book too. Michelle, what about you? Any final thoughts?
I just think it's about community being involved. And you heard me say I get too technical sometimes. And by the way, that was done by my daughter's fiance again, because he was reading the article I wrote and he was like, wow, that's really technical. So, okay. What it comes down to is in every aspect of your life. I happen to be on the board of Skating Club of New York because my daughter was a competitive figure skater. But one of the things I would bring out is, yes, we have all these issues dealing with diversity and these young people get hurt. But I started sitting at the rink and noticing these kids are stressed. They're competing at a high level. They need to know that they can talk to somebody about their mental health, even if it's the mom. And they started groups. And I would go at it not from saying we need to always focus on their mental health, but let's do things so that the kids really get to know each other, because they're in different areas. And you can go to your community. It could be your community group. They might have a free workshop in mental health for parents of athletes in sports. You don't know, or even the public health department. And they started having things for young men so that men could bond in this sport that doesn't seem to have a lot of men in it. And also really hearing young women taking them seriously. And that came because gymnastics and figure skating talked about safe sport. So realize there's a lot of places you can get support in your everyday life. And public health is a part of that. It doesn't have to be a disaster. It doesn't have to be going to the emergency room or to the doctor. I loved your example about the hole in the street, pothole in the street. All of that, you call the same number, at least in New York City, 311, and that gets it done. And that's a part of the Department of.
Thank you for that, Michelle, and everyone. I really appreciate your insights, taking the time to share it here. It's really important. And I know our audience will really appreciate that. thank you for being here. We'll make sure that connection links will be in the show notes for this episode for people that are interested in connecting with you. Look forward to keeping in touch. I really hope you enjoyed that conversation as much as we did. Public health doesn't always make headlines. It shows up in the grooves in a highway, a teenager at a career fair realizing that they could get paid to listen, and a woman who went from hoping to earn $40,000 to actually earning six figures and buying her first home. When professionals can hand the public around them a story that sticks, those stories travel. That's the challenge this episode leaves you with. Find the examples, share them often, and trust the people closest to you will carry them further away than you can expect. I encourage you to connect with each of our guests from this episode and learn more about the work that they're doing. You can find the links to connect with them on the show notes page. The show notes page for this episode is episode 449. Can be found at phecpodcast.com. Once you're there, just navigate to episode 449 to find the show notes. One more thing before we go. Remember that our podcast has an app and a private community, independent of social media platforms, where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes like this one. You can download our PHEC podcast community app in your mobile app store and is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.